Welcome to Uniquely Spoken. This is part one of transparent video series dedicated to shedding light on the challenges within nursing homes and their impact on residents, staff, and organizations. In this episode, we will take a deep dive into the risk associated with medication management, exposing the complex hurdles nurses are facing in nursing home settings. Our only mission is to provide a clear and honest perspective on resident safety concerns, the regulatory challenges nurses navigate daily, and the collective effort to push for practical, optimized nursing home policies. By presenting raw, unfiltered data, we aim to highlight the alarming rates of medication errors, legal issues, and hospitalizations in nursing home settings. This research challenges existing narratives and regulations that minimize medication management's role in staffing ratios. Through transparency, we offer a first-hand look into the realities of a nurse's daily journey in these nursing home settings. While medication management remains one of the most critical aspects of long-term care, its impact on both staff and residents is often underestimated. A deeper understanding of these challenges allows facilities to develop more effective strategies and our government to look at what their regulations are asking and demanding, improving medication oversight and regulatory compliance. Post-COVID, some states have implemented regulations allowing certified medication aides to manage certain medications, excluding G-tubes, narcotics, and insulin, demonstrating their efforts to reduce this risk. What must also be considered is that nurses and staff must have a heart of compassion, empathy, and caring to go that extra mile to ensure medication delivery and compliance. As I conducted research on this matter, various statistics paint a stark picture of medication management in long-term care. I encourage you to also research websites where you will see many articles providing alarming rates for preventable medication-related injuries, making it clear that medication errors remain a critical concern. This highlights the urgent need for improved regulations and necessitates the need for transparency and revolution. The data provided strengthens the argument that medication management shouldn't be minimized when evaluating staffing ratios and regulatory standards. It underscores the importance of transparency, proactive intervention, and reforms that prioritize both resident safety and staff support. Absolutely, you will see these statistics underscore the weighty responsibility long-term care facilities have in safeguarding residents. The prevalence of medication errors not only puts resident health and staff at risk, but also erodes trust in the system, making it even difficult for families or a resident to feel confident in their choices. The characterization of these errors as all too common in Berman and Riddell's article reinforces the urgent need for reform. Strengthening medication management protocols, prioritizing transparency, and implementing proactive safeguards and regulations can mitigate risk and enhance both resident well-being and legal protection. And it is well known that the rise of social media has given nurses a powerful platform to share their experiences, exposing the reality of long-term care challenges to a global audience. Viral posts and videos capture their exhaustion, burnout, and overwhelming pressures that these nurses are facing. Some are even showing nurses falling asleep on medications carts due to sheer fatigue. Millions of responses echo these concerns, emphasizing the urgent need for systemic change. Nursing homes have become daunting working places for many professionals, not just because of staffing ratios and low pay, but due to the immense risk placed on their licensors based on regulatory expectations and demands. And it is well known that the rise of social media has given nurses a powerful platform to share their experiences, exposing the reality of long-term care challenges to a global audience. Viral posts and videos capture their exhaustion, burnout, and overwhelming pressures that these nurses are facing. Some are even showing nurses falling asleep on medications carts due to sheer fatigue. Millions of responses echo these concerns, emphasizing the urgent need for systemic change. Nursing homes have become daunting working places for many professionals, not just because of staffing ratios and low pay, but due to the immense risk placed on their licensors based on regulatory expectations and demands. Transparency is key to exposing the real root causes of medication errors in long-term care facilities. Unveiling the true causes of medication errors in nursing homes is critical to fostering real change. By exposing medication administration challenges, unreported mistakes, systemic inefficiencies, unattainable regulations, and disturbing statistics, regulators and facilities can move toward meaningful improvements rather than overlooking life-threatening risk. This approach goes beyond merely acknowledging the problem. It encourages accountability and drives the creation of policies that prioritize both resident safety and staff well-being. With transparency taking center stage, long-term care facilities and regulators can improve workflows and ultimately enhance the quality of care residents are receiving. We will take an inside look at 14 key components of nursing home medication management that stem from several interwoven factors that demand precision, efficiency, and adequate staffing. Each component adds complexity, reinforcing the need for systemic improvements and stronger support structures. Let's get started. Number one, what better time than now than to introduce a key player in nursing home medication management, the medication cart. Before we dive in, it's important to recognize the essential role this cart plays in a nurse's journey throughout long-term care settings. Medication carts are more than just storage units. They are the backbone of daily med passes, storing various forms of medication and often stuffed to capacity. If these carts could talk, they'd have some very unique and fascinating stories to share. Designed specifically for the demands of nursing homes, medication carts come in various styles and sizes, tailored to support the diverse needs of residents and the intense workload of nurses and medication aides if used in nursing homes. As you look at the top of the cart, it only gives an inclination of what's inside. On top of this cart, there is a paper medication record that has been widely replaced by computerized systems. However, the contents remain the same. This is a structured system built to maintain efficiency and ensure safe medication administration in an environment where precision is everything. Number two, polypharmacy, the practice of residents taking 5 or more medications simultaneously. This is an overwhelming challenge in nursing homes. Nurses find themselves struggling under the weight of overflowing medication carts, managing complex regimens that demand precision and vigilance. With 50% of residents taking more than 5 medications based on several sites during the research, show a single medication pass is staggering. To mitigate risk, nurses must verify each medication order 3 times before administering it. However, many residents struggle to take all of their medications at once, preferencing to space them out or to take them based on their size one at a time. This adds yet another layer of complexity to an already demanding process. Number 3, administering medications through a feeding tube is an intricate, time-intensive process, particularly when polypharmacy is involved. This process includes several critical steps. Verifying tube placement by auscultating the site to confirm the G-tube placement before any medication is administered. And then the medication setup. You have to retrieve all medications and separately crush each medication or mixing powders with water for safe administration. Now we're at administering the medications, and each must be given one at a time with water flushes before and after to prevent potential drug-to-drug interactions and maintain tube patency, making efficiency and precision essential. Labeling of the tube feeding bottle and the water bottles are required to have resident identification, flow rate, date, and time, as tube feedings expire after 24 hours. The complexity of feeding tube medication administration exemplifies just one of the many challenges nurses face daily. The demand for careful organization, accuracy, and adherence to safety protocols only amplifies with high resident loads and staffing shortages. And did I mention, tube feeding pumps frequently require troubleshooting, and tubes clogs can be another challenge with medication administration with tube feedings. Number 4, bolus tube feeding. Administered by gravity introduces yet another layer of complexity to the process. Unlike pump-assisted feedings, the flow rate depends entirely on the thickness of the formula, which can significantly impact the time required for administration. Thicker formulas slow the rate, sometimes leading to frustrating delays and an increased risk of clogged feeding tubes. When tubes clog, nurses must take additional steps to clear them, often requiring extra flushes, adjustments, or even specialized unclogging techniques, all while ensuring the resident receives the correct amount of nutrition. These setbacks can turn an already consuming task into an even longer one, especially in facilities where nurses are faced with more than one G tube to manage. This heightens the pressure to complete tasks efficiently. Number 5, diabetes management in long-term care facilities is a major undertaking, with prevalence rates estimated between 20 and 34% in the United States, according to the Senior List article on December 11, 2024. Now picture the daily workload in a nurse's journey. Most diabetic residents require 1 to 4 fingerstick tests per day, with the majority checked 3 times daily before meals. And it also requires insulin administration, often followed by demanding precision in dosage and timing. Each blood glucose monitoring device also must be disinfected and allowed to dry for 2 to 5 minutes between uses to uphold infection control standards, since the equipment comes into contact with blood. Given the sheer number of residents requiring blood sugar checks, these steps add significant time and complexity to medication passes. Without adequate staffing, nurses are left balancing precision with speed, ensuring every reading is accurate while meeting tight regulatory windows. And number 6, eye drop administration. Yet another meticulous process in nursing home that demands time, precision, and patience. With studies showing anywhere from 32 to 83% prevalence of cataracts and 5 to 41% of residents living with glaucoma, it's no surprise that multiple prescription eye drops are common. But here's the challenge. Each eye drop must be administered at least 5 minutes apart to ensure proper absorption and effectiveness. This means that for residents requiring 2 or more different eye drops, nurses must carefully space out each application while managing other responsibilities. The process isn't just about squeezing a drop into the eye. It involves positioning the resident correctly, preventing contamination, and ensuring the right dosage. Given the high rates of vision-related conditions in long-term care, eye drop administration is not just a routine task, it's an essential part of preserving residents' eye health and preventing complications. A bigger challenge is getting the residents to keep their eyes open as the drop is administered. Number 7, patches add yet another layer to the medication management process, requiring careful handling to ensure proper effectiveness, whether for pain relief, behavior management, hormone replacement, blood pressure control, or even smoking cessation. Each patch must be dated, initialed, and correctly applied. A small but essential step in maintaining treatment accuracy. While applying patches may seem like a quick task, it is another detail-oriented responsibility. And number 8, inhalers certainly demand precision and resident cooperation, making their administration a unique challenge in nursing homes. Unlike pills or patches, they require deep, controlled inhalation to ensure the medication reaches the lungs effectively. A step that can be difficult for residents with cognitive impairments or physical limitations. For routine inhalers, nurses must ensure consistent scheduled doses, while as-needed inhalers require close symptom monitoring to determine when intervention is necessary. In cases where residents struggle with technique, nurses often need to provide hands-on guidance, coaching residents to inhale properly rather than wasting medication or failure to administer a medication according to a physician's order. Additionally, for certain inhalers, mouth rinsing is a crucial post-use step to prevent thrush and dry mouth complications. Ensuring residents follow through with rinsing and spitting can add yet another layer to the medication pass workload, especially for the cognitive impaired. Number 9, arthritis and joint pain call for hands-on care, literally. Nurses must apply prescription creams designed to soothe pain, reduce inflammation, and ease stiffness, ensuring residents get the relief they need. Alongside these pain management creams, prescription lotions for dry skin play a factor in keeping skin hydrated and healthy, preventing discomfort and irritation. Though applying these creams and lotions may seem like a quick task, it is another essential step in resident care. Number 10, injections are another crucial component of medication management, spanning a wide range of treatments beyond diabetic care. While diabetic residents make up a significant portion of those requiring injections, other conditions demand careful preparation, accurate dosage verification, and proper administration technique to prevent complications and to maintain compliance with physician orders. Number 11, nasal sprays come with their own set of challenges. While they help manage allergies, congestion, and respiratory conditions, ensuring proper use is essential. One common issue is getting residents to rinse and spit properly after administration. This step is crucial for preventing side effects like dry mouth and thrush, a fungal infection that develops if residue lingers in the mouth or throat, especially those with cognitive impairments or mobility restrictions. Following these post-use instructions can be difficult. Nurses often have to provide extra guidance, reminders, or hand-on assistance to ensure medication is consumed as ordered for effectiveness. Number 12, nebulizer treatments. These treatments last 15 minutes or more for inhalation therapy that nurses must ensure proper administration and compliance to physician orders to maximize effectiveness. Resident cognitive status and cooperation play a big role. Some may follow the process independently, while others require close supervision to ensure they inhale the full dose properly. In many cases, leaving a resident alone during treatment is not an option, as incomplete medication delivery can compromise respiratory health. This level of direct intervention demands patience and attentiveness, especially when managing multiple residents with nebulizer treatments in one medication pass. It reinforces the importance of strong staffing ratios, ensuring nurses have time needed to oversee these treatments without sacrificing quality of care in compliance with physician orders. Number 11, monitoring blood pressure and pulse before administering certain medications is a non-negotiable safety measure, ensuring effectiveness and preventing potential adverse reactions. And given that 76.9% of nursing home residents have hypertension, according to a 2025 article in Makeshift, this vital step is an essential safeguard in long-term care nursing homes. Most nurses prefer to take their own vitals, recognizing the high stakes of accuracy, because incorrect readings can lead to serious health complications. But this process, while necessary, adds significant time to already demanding medication passes. With multiple residents requiring pre-dosing checks, nurses must balance precision, efficiency, and urgent care needs, all within the constraints of strict regulatory windows. This again highlights yet another layer of workload pressure. Nurses must operate at peak attentiveness, ensuring medication decisions are based on reliable data while managing tight schedules. And keep in mind, it all depends on the resident. Residents with cognitive impairment all too often takes more time because you have to get them to buy into the process. Now, number 14, the last component in this video, IV medications and fluids that require careful coordination alongside routine medication passes. Each IV bag must be properly labeled and the tubing dated, ensuring compliance with safety protocols. However, if IV access is compromised, nurses face the time-consuming task of starting a new line or adjusting the setup to maintain effectiveness and administration. The IV pump itself presents challenges when faced with troubleshooting to ensure infusion. Nurses must stay extremely vigilant for monitoring IV flow alerts, assessing IV insertion site, monitoring for occlusions and infiltration, and ensuring the line remains intact. Balancing efficiency with resident safety is paramount, as IV therapy is often required for critical conditions that demand immediate attention, given another time-intensive nature. And now that we have reviewed the harsh reality through transparency about medication passes and regulations, factoring in the 14 complexities of medication management, it has become clear that nurses are operating under extreme time constraints with little room for error, yet extreme opportunities for errors. Let's do some math. Let's say a nurse has 26 residents and exclude any of the 14 complexities in the regulatory 2-hour window. This will equate to 4.6 minutes per resident, slightly less than 5 minutes. This estimation is rapidly chipped away if we were to include feeding tube protocols, vital sign monitoring, nebulizer treatments, diabetes management, and any other of the complexities discussed. And let's not mention unpredictable interruptions. This transparency exposes a fundamental issue. The current system does not, let me say that again, does not allow nurses adequate time to complete med passes safely while maintaining precision, resident engagement, and compliance protocols. Facilities and regulators often mask these struggles, presenting medication administration as a straightforward process, when in reality, nurses juggle layers of complexity that directly impact resident safety and care quality. By shedding light on the real numbers and challenges, we confront the root causes of medication errors, rushed administration, and compromised patient outcomes. The industry must move toward honest conversations about staffing levels, workflow efficiency, and policy reforms that acknowledge what nurses actually experience while managing medications, not just what looks good on paper. And did you know morning medication pass is the largest medication pass throughout a day, all too often. And just as the morning challenge wraps up, another unfolds. Here comes the noon med pass with diabetic blood sugar checks, physician consultations, and the continuous balancing act of resident care. Medication management is also only just the tip of the iceberg. In Chapter 2, we will offer a deeper dive into the other essential responsibilities shaping a nurse's day: wound care, behavioral interventions, emergency response, assessments, appointments, and mealtime oversight. Each task requires meticulous precision, rapid decision making, and an unshakable commitment to resident well-being. Were you aware that some nurses have run from nursing homes? Therefore, some states have succumbed to having to expand the role of medication aids that are typically used in assisted livings into nursing homes, allowing the medication aids to manage medication administration while nurses are to focus on other critical components of resident care. The intent behind this shift is to reduce nurse workload, improve efficiency, and ensure timely medication delivery. But has it actually improved outcomes? Based on my research through AI, it states what the research says. Studies suggest that facilities using medication aids have seen mixed results. One study found that medication aid use decreased the probability of facilities receiving deficiency citations for unnecessary drug use or medication errors. However, another study noted that reducing licensed nurse staffing while increasing medication aid use led to more inspection deficiency and monetary penalties. The nurses' perspectives. Some nurses embrace the concept, appreciating the relief from medication-heavy workloads, allowing them to focus on assessments, wound care, and emergency response. Others express concerns that medication aids may lack the clinical judgment needed to recognize early signs of adverse reactions or complications. My take is, what is the difference with the rate of medication errors at this point? Although in assisted living, where medication aids are only to assist with medications and not administer, they are actually administering all too often. The bigger question: the success of medication aids depends on implementation. Are they properly trained? Are nurses still available for that oversight that is necessitated? Are facilities using this model to enhance care or simply cut costs? Do nurses still have the heart and compassion to give their best after years of burnout? Do nurses recognize their legal responsibility as the nurse overseeing these medication aids? Let's talk about it. Have you seen positive changes with medication aids being added into long-term care settings? Or do you think this shift compromises resident safety? Medication management alone demands constant focus, but it's only one piece of a much larger puzzle. Balancing resident care, regulatory compliance, unforeseen health complications, and the sheer weight of responsibility make nursing in nursing homes a truly demanding profession. In our upcoming Chapter 2, we will take a deeper dive into a nurse's daily journey and a critical look at the other responsibilities that extend beyond medication administration. Despite some states shifting their focus to low staff ratios and acuity-based staffing models, many continue to operate under minimal staffing requirements, leaving nurses overwhelmed, resident safety at risk, and nurses licensure. While acuity ratios aim to prioritize residents with higher needs, they don't always address the overall workload challenges, especially in nursing home settings, where complex medication management, assessments, and daily interventions are constant. Without strict staffing mandates, and based on a 2023 research by ABT and Associates, facilities can justify lower nurse to resident ratios through this transparency, even when acuity demands more hands-on care. This contributes to burnout, increased medication errors, and heightened resident safety risk, making transparency and reform more crucial than ever. Nurses, your voices matter. Staffing ratios shape your workload, your stress levels, and most importantly, the safety of your residents. Share your story. What are staffing ratios like in your state? What challenges do you face daily? Are med passes overwhelming? Are resident safety risks increasing? Does burnout feel inevitable? Does staffing ratio impact your performance and outcomes? Your firsthand experiences paint the real picture, the one that must be seen, heard, and acted upon. Make your voice matter. Speak up. Share your story. Let's unite to drive change. Thank you for choosing UnIqUeLeE SpOkEn for your transformational coaching and training needs. I hope it inspired you, sparked innovative ideas, or provided valuable insights. Every action you take contributes to making a difference in healthcare and beyond. If you find this coaching valuable, do not forget to explore our other coaching programs. Follow us on Facebook, Instagram, and TikTok. Like, subscribe, share, and follow us. And stay connected for more impactful content. We also invite you to explore our blog, share your thoughts in the comments, schedule healthcare consultations via our website at UnIqUeLeeSpOkEN.com. We're here to support your journey in development. Thank you.